Hey everybody, welcome back. Today we will be completing our discussion of the craniofacial vasculature with the discussion of the craniofacial veins. We'll provide a brief overview of the important venous structures that drain structures of the head and neck. So let's kick things off by orienting ourselves to the aortic arch again, but this time let's focus on the veins. So firstly, let's focus on the inferior vena cava and the superior vena cava. So structures below the heart drain into the inferior vena cava, while structures above the heart drain into the superior vena cava. So next, let's look at the brachiocephalic veins. These veins are formed by the convergence of the internal jugular vein and the subclavian vein on each side of the body. The primary function of these veins is to collect deoxygenated blood from the head, neck, upper limbs, and upper part of the thorax and funnel it all into the superior vena cava. Lastly, we'll look at the subclavian veins. These veins drain blood from the upper extremities and join with the internal jugular veins to form the brachiocephalic veins, which lead to the superior vena cava. So now we're going for the jugular as we move on to the jugular veins. So the jugular veins can be divided into the internal jugular veins and the external jugular veins. So starting off with the internal jugular veins, they run alongside the carotid arteries. This is within the carotid sheath deep in the neck, and they collect blood from the brain, face, and neck. The external jugular veins are more superficial, as the name suggests, and they drain blood from the scalp, face, and parts of the neck. Both the internal and external jugular veins transport blood back to the heart via the brachiocephalic veins and the superior vena cava, ensuring proper circulation. And now we're moving on to the facial vein. And the facial vein is perhaps the most important vein to know for your exam. So this vein, beginning at the medial angle of the eye as the angular vein, it descends obliquely across the face, passing behind the facial artery. So notice how it runs alongside the nose, across the cheek, and along the lower border of the mandible. The facial vein ultimately drains into the internal jugular vein. And I'm going to say it again, that the facial vein ultimately drains into the jugular vein because this is a high-yield topic. An important clinical consideration to note here is that adverse cardiovascular events have been reported in patients who have had local anesthesia mistakenly injected into the lingual vein. These adverse effects can manifest as tachycardia, positive blood aspiration, hypertension, and palpitations. So let's look more closely at the drainage areas and tributaries of the facial vein. So first, the facial vein collects blood from several important superficial areas. So one of the most important topics to know for the purposes of the exam is that the lingual vein drains blood from the tongue, which is high yield. Another important high yield topic is that the lingual vein and facial veins drain into the internal jugular vein. Next, we have several smaller veins or tributaries that join the facial vein along its course. The anterior facial vein, which drains from the forehead and the interior part of the scalp. And then we have the deep facial vein, which drains from the pterygoid venous plexus. And then we have the labial vein from the lips. And then we have the submental vein from the area under the chin. Next, we're moving on to the pterygoid plexus. Now, the pterygoid plexus is a network of small veins located within the infratemporal fossa, a deep space located beneath the base of the skull and behind the maxilla, near the lateral pterygoid muscle. The venous plexus receives blood from several key anatomical areas related to dentistry, including the maxillary teeth and gums, the muscles of mastication, the nasal cavity, the paranasal sinuses, and parts of the oral cavity. So further orienting ourselves now, the pterygoid plexus is closely related to the facial vein, the maxillary vein, and the cavernous sinus. The pterygoid plexus is connected to the facial vein via the deep facial vein, which provides a pathway for blood from the deep structures of the face to the superficial venous system. The pterygoid plexus also drains into the maxillary vein, which is a significant tributary of the retromandibular vein. Finally, the pterygoid plexus has connections with the cavernous sinus, which we'll discuss next. Before we move on to that, however, it's important to mention the clinical significance of the plexus when it comes to infection spread and surgical considerations. Because of its connections with the facial vein, maxillary vein, and cavernous sinus, the pterygoid plexus can serve as a route for the spread of infection from the face and oral cavity to deeper structures, including the brain. So my brainworms prevent infection, but your patients don't necessarily have brainworms. The pterygoid plexus is also an important consideration for dental/maxillofacial surgery due to its location and potential for significant bleeding if inadvertently injured. The last structure we'll focus on is the cavernous sinus. Now, this is a large complex of venous sinus located on either side of the sella turcica that drains blood from the brain and the orbit. So let's take a closer look at this neurovascular network, okay? So it's not only home to veins, it's also home to a lot of other stuff. As we can see, it's home to the cranial nerve 3, the oculomotor nerve, cranial nerve 4, cranial nerve 6, cranial nerve V1, and cranial nerve V2. Additionally, the cavernous portion of the internal carotid artery also passes through the cavernous sinus. The cavernous sinus drains blood from the orbit via the superior and inferior ophthalmic veins and from the brain via the superficial middle cerebral vein and the sphenoparietal sinus. Blood from the pterygoid plexus and facial veins can also flow into the cavernous sinus via emissary veins. Finally, important clinical considerations for the cavernous sinus include cavernous sinus thrombosis, which can have serious complications, such as cranial nerve palsies, facial pain, periorbital edema, ptosis due to impaired venous drainage of the orbit, and other orbital findings. Now let's move on to our first and only example question. Example question 1, where does the facial vein drain into? So here are your answer choices, and you can pause if you want, but I'm going to move right ahead with the answer, which is A, the internal jugular vein. The facial vein drains into the internal jugular vein at the level of the hyoid bone. The same goes for the lingual vein. It also drains into the internal jugular vein. And now we're moving on to a summary of things that we talked about today, as always. So the first thing I want to talk about is that the lingual vein drains into the internal jugular vein, and the facial vein does the same thing. It drains into the internal jugular vein. And then we also touched on cavernous sinus thrombosis. Thank you so much.